Hey, this is Chris, keeping it real. How you doing this morning? We're talking about masks. I guess the word has come down from whatever health organization you might want to care to follow that, the guidelines have been changed and now they all recommend that we wear a mask when we go in public, not to save ourselves from getting sick, because a mask like that is completely worthless for that purpose, evidently, but to keep us from spreading germs to other people while we might be asymptomatic or pre-symptomatic or whatever kind of symptomatic we could possibly be. And I think this is where I'm just going to kind of draw the line in the sand, and I'm not going to do anything more than is already being asked of me. For like 3 months now, we've been told that 6 feet of distance is sufficient to stop the spread of the virus. And either that statement is true or that statement is not true. It can't be both. So we've either been lied to for the last 3 months, or 6 feet is in fact enough, and I do believe that 6 feet is enough. I think you can go to the store, you can keep that social distance, and I think that works. And so I'm just not going to do it. I mean, all these organizations now that are coming out with these guidelines, such as the World Health Organization and the Center for Disease Control and whatever other medical authority there is in the world or in the United States of America, they have pretty much blown this whole thing from day one. They were slow to react. They haven't made sure anybody gets any test kits. I don't know what they're doing. But it's kind of like when we say it, a favorite saying of ours is, you had one job and you didn't do it. And so you had that one job. Your job was to identify health risks and do something about it. Be proactive early and do something about it. Making everybody stay in a lockdown is not doing something about it. That's making somebody else do something about it. That is a sign of your failure, not a sign of anything else. You're not doing anything. It's easy to just tell people to stay home, or it's easy to tell people to wear masks, or it's easy to tell people, not to get together with family members. I mean, all those things are easy because it doesn't require any effort on the part of those who are making those recommendations. All it is them talking, and I'm tired of talking. I wish that someone would actually do something, like get out some antibody tests so we can find out who's got it and who doesn't. You still can't get one unless you present yourself at the hospital with clear symptoms, then you get one. Other than that, you don't. So it's like I'm being asked to wear a mask because somebody was not on the ball from day one getting antibody tests together. I can't believe it takes this long to do that. We supposedly have the greatest healthcare system in the world, but it's taken this long. And we still don't really have any in a sufficient quantity to test anybody. Because I guess it's just so much easier just to tell everybody else what to do. And then when you get around to finishing your job, you have just one job. Then you will finally get those tests rolled out. But in the meantime, you just expect us all to be sheep and do what you say. And it's like, I'm just not going to do that. Not when there is a relevant means of preventing the spread of the infection, which is keep your distance. And so that's just what I've decided to do. I mean, unless of course, the governor orders it, I'm not going to do it. I mean, if we're talking about, cops walking around handing out tickets because you don't have a mask on out in public, okay, I guess I will. But that's just coercion, right? That's not the way things are supposed to be. But this whole experience is really, this whole virus thing, and I understand people are dying. I mean, and that is unfortunate. It really is. But that's what happens during a pandemic. You know, that's just a byproduct of having a pandemic. That's the way it is. I think that keeping our distance, I mean, up until now we've kept our distance, so it means, you know, we definitely were just keeping distances 6 months ago. I mean, not 6 months ago, 30 days ago, right? So the people who were dying now, nobody had a mask 30 days ago. And somehow New York has sent the hospital ship home. Everything is back as well. I mean, I don't think it's back to normal, but they're at a place where they can handle it now. That was 30 days ago, and simply social distancing and staying home was sufficient to drop those numbers down to a reasonable level. Which, again, I have to remind everyone, that is the point of all the things we're doing. We're not doing it because it's going to save anybody's life. We're doing it so that the hospitals aren't overwhelmed, and so that if people do die, it's not because they couldn't get care, or because they couldn't get quality care, or there wasn't a bed available. We're doing it to make sure that people have access to a bed if they need a bed, and that's it. And once they get in that bed, the odds are highly unlikely that they're going to come back out of it if they're admitted with serious complications and all that. You know, there's all kinds of things. So, bunny rabbit. So yeah, I'm growing weary of just being told what to do when the people are telling me what to do. I don't see any results of what they're supposed to do. You know, about the time that they show me that they've stepped up to the plate and they're actually delivering something that's of value to me, then I will start listening a little harder. But up until that point, I'm going to keep on doing what I'm doing, which, by the way, is going to work this morning. Because, you know what? People just can't sit around for a year and not work. Everybody's got bills. And you know what? Landlords and the banks and everybody that controls the money, they aren't taking less money. No, it's just us out here who are bearing the brunt of all this. And we didn't do anything. And it wasn't our job to do anything. They had one job. Got any questions or comments? Leave them in the section below. Like and subscribe. We appreciate when you do. We'll see you on the next video.